This file is an attachment to any congressional testimony I have on healthcare. It's about single payer. You can find the full text on a link downstairs in the description. I will hit the high points and a lot of it. So, but there's more if you click the link. Click the link. Excuse me. Again, there is no logic in rewarding people with good genes and punishing those who are not so lucky, which I suspect is most of us, nor is there logic to giving health insurance companies a subsidy in finding the healthy and denying coverage for the sick, except the logic of the bottom line. Another accident is you have dead parents, and you don't have to pay for them if you're on your own. Whereas if you've got two parents and your wife has two parents and you got no kids, not only are you not covered, but you got to pay for them, and you got to pay for you. So the logic of social insurance is that everybody gets paid now. So insurance companies on their own, especially, don't like mandates. They resist community rating, and again, the voters resist mandates. Insurance companies actually love mandates, but the young and the lucky and the healthy, they resist. They resisted well enough, and the wealthy, frankly, who get gold-plated insurance, and they pay higher, and they pay for Obamacare premiums, and they pay taxes for Medicare. So yeah, they don't like mandates. Now the recent reforms, called Obamacare, have higher deductibles, and they're not adequate. They exclude undocumented workers, and they make and they have high copays. So reform is inevitable, and that reform is probably some form of single payer. There's a couple of ways to do it. There's a non-way, which gets rid of insurance, but it's also what you do when you get rid of capitalism, which and that's the way that you save costs, is to get rid of capitalism and the government that enables it. That's the libertarian socialist position. But this is the ultimate social democratic position is, of course, the public option. But you would have to get it passed, you'd have to end protections for pre-existing conditions. And you can live without mandates too. The public option would cover all families and individuals who are rejected for either pre-existing conditions or the inability to pay. There might be, for higher income people with pre-existing conditions, there might be some kind of premium, but the copays would go away, would be filled up so fast, and the lifetime limits would be so easily met that they would eventually go to the public option, and they can't pay for the copays. Being chronically ill is expensive, and that's why we have social insurance. You would essentially expand Medicaid to include everybody with a pre-existing condition, and that would require some higher taxes, because you can't do a public option on the premiums. It's not that efficient. You've got to be more generous, and it should include Medicaid. Now, Medicaid for seniors, and this is the second option, should be taken away from the states, which they would love, and be part of a Medicare Part E, because the states can't afford it. The states actually also can't afford their pensions. At least they're told that by the people who are actuaries who are in bed with or closely related to the people who sell option or alternatives to pensions. We call those defined contribution plans, which means, if you're rich, it's great. If you ain't rich, it ain't great. So, if you have a lower income, you can't save, no matter what is attached to it. So, again, Medicaid Part E would take care of these people. Now, there's a few functions of Medicaid Part E. The main point of it is that there are two Medicares. There's the Medicare for the really sick and the Medicare for the not really sick. The one for the really sick is Medicaid. If you're chronically ill in a nursing home, you could shift it over, but then you have to deal with who pays what. So if you go to the hospital, then A pays for it. If you sent back to the nursing home, then somebody else pays for it. B pays for something else. Putting it all under Medicare with a Part E, it's a lot easier, and people aren't competing for who avoids the cost. That's why we have a proposal for Medicare for all. And again, Part E eventually takes over Part A, and especially Part B, and especially Part D, because then you can make a better deal with the drug companies, and you should be able to deal with the drug companies. And of course, Part C, Medicare Advantage. If it all rolls into Part E, you've got Medicare for all. At first it wouldn't, but eventually it would. And the camel's nose and the camel needs to get into the tent is a Part E. And the states would love it. Again, that's their one of their bad too, and of course, expanding Social Security into the state pensions, like FERS did for the federal pensions, is probably the best option. Again, social insurance is cheaper for everybody, and then you would have an additional pension that makes sure that nobody is harmed, no retiree and no current employee is harmed by a switch to Social Security. But yeah, it should be a pension, not a set of savings accounts. It shouldn't run out, and your spouse shouldn't have to worry about it either. So that's the pension problem, and that's Medicare for all. And Obamacare is kind of Medicare for all, but it's not really. It gives supports. I mean, it's mostly a single system. It doesn't look like one, but it's modeled after the Federal Employees Health Benefit Program. And of course, federal employees are adequately paid. We need a higher minimum wage. That would make Social Security more generous, because a higher minimum wage means inflation. And inflation means, again, rebasing benefits. You don't have to have higher taxes. You don't have to cut services. You just have to raise wages. And then people actually can save. But hopefully for medicine, they won't have to. So now here's the third option. Both options require higher taxes. And they should be broad-based, because if you just tax the rich, you have a lack of combiting the system. It becomes an issue to embarrass the Republicans, yet they don't care. Their voters expect them to be embarrassed. Democratic voters and independents won't change their mind on who their party is because of whatever taxes there are. In fact, most Democrats would probably be fine with a payroll tax, but a broad-based consumption tax would be even better. The broad-based consumption tax could be one of three. An asset VAT, which if hits the rich too hard, and such a tax should actually be dedicated to getting capitalism done, so that people who pay the asset VAT would pay it, but there should be a exemption to paying it if you sell your shares to or any other property or ownership, public or private, to the employees for a broad-based ESOP. Otherwise, under the asset, and I'll explain this all so that my time doesn't run out. But one of the options, the other options are a broad-based consumption tax and a subtraction VAT, which is essentially a tax on the employers, and it's there's a tax benefit for employers now against the corporate income tax, which is also used to be called the corporate profits tax. That would go away, and the subtraction VAT would essentially pay for services that should be funded by employers and would be funded by the state. A subtraction VAT would allow the employers to pay less in taxes if they provided direct coverage to their employees, meaning they hire doctors. If you hire the doctor, if you pay an HMO type arrangement with specialists and hospitals for inpatient care, or even by the hospital if you're big like GM, then you get a tax benefit for doing that. It essentially means that funding and costs are in one consistent package, and that consistent package gives an incentive to cut costs. Private insurance or government insurance has the incentive to overuse. If employers are managing the care by hiring the doctors, they can match services to need and while controlling costs. And if it's an employee-owned company, nobody is going to be underserved. So everybody will be taken care of as well. That's an important part of it. Again, the big issue is tax reform. It always is for healthcare. It's, any option, is a good option if it's funded. The question is funding, just like with government as a whole. If we have good funding for government, people will not resist taxes. And that's the next video, because I am on 13 minutes and I don't have time to cover a broad-based tax plan in the 2 minutes left that YouTube allows for those of us who are not paying for it or don't have the adequate subscribers. So we will see you in the next video. Thank you for your attention. And again, the usual things are in the chat for Patreon, for link support, share, all of that. So yes, please do so, because it helps me to live a better life than I live just on disability payments, and later on retirement payments. So yes, please help me monetize. Thank you much.